This is a basic examination of the hip joint. What we'd look for is a degree of symmetry to check for leg length, look for the alignment of the pelvis, and as with the back assessment, check for the posture of the person. The hip joint's a ball and socket joint, so it has a very large range of movement. We need to check the range of movement and also check the muscles, that they're functioning to both support the joint and provide that mobility. As a start off, we will go through just basic simple tests. If you could go up onto your tiptoes and walk one foot to the other. Now onto the heels of your feet. And now let your feet rest and just stand on one leg. Raise the other knee up in front of you. Again, if balance is needed for this, offer some support. Otherwise, we are looking to see if the person can sustain good balance and appropriate alignment of the pelvis. In a single leg stance, if you'd like to raise that leg up, it's quite common that you may see people lean to one side to gain their centre of support, or it's too laxed around the hip joint and this pelvis will drop. These are common findings and often have to do with the strength and recruitment of the gluteal muscles. To further test the hip joint, we would ask the patient to go into a lying position. And again, we'll check for the range of movement, bringing the hip joint up into a range of flexion and a degree of overpressure, really checking that the joint can gain that full movement. There is also rotational movements around the hip joint, bringing it into medial rotation and into lateral rotation. Over from this position, we can also check for the abduction of the joint, taking note where the pelvis is. Very often again, after a period of movement, the entire spine will begin to flex. Important to check that the movement is from the hip and not from the side of the person flexing. To check for the muscles in and around the joints, ask the patient to pull the knee up towards the chest for the hip flexors. Again, for the medial rotators, I'm going to push your ankle that way, push against me. And now push back in towards me. For the adductors, squeeze the knees together and push the knees apart. Further tests around the hip can be performed by stressing the strength of the gluteal muscles. If you'd like to go to lift your pelvis off the bed, it's a very good one for checking the gluteal strength, and back down. If you'd like to roll over onto your right side, and again further tests. In this position, ask the patient to bring the knee up, hold the position. I'm going to push down, push against me. And finally, we'll do a straight leg test, keeping the posture in alignment, holding the leg out and push against me. To complete the test, all the way over into a prone position. And over from here, we can check again the range of movement around the knee, stretching the hip flexors at the front. We can also check the rotation in this position and look for any restriction of movement. If needed, you could test for the resisted tests again, and you can also add in to check for the full hip extension. The feedback from these tests should give a good overall picture of whether the hip's got good strength, good range of movement and good functionality.